The other thing that happened too with the kid not nursing correctly, she wasn't getting any milk. And weirdly enough, what I did in that case was the exact opposite of what I would have done with a human baby. And that is, I was milking her mom and feeding her with a Pritchard teat, which is very long and it's hard. So she doesn't really have much of a choice. Like this long, hard plastic nipple was going back into her mouth, and she took it and she got milk. And then within a few days, she was willing to go ahead and nurse correctly on mom. And so when she latched onto mom, she was able to get the whole teat in her mouth. Sometimes if you have really super small babies, they might need you to help support like their chin, because if they're small or kind of weak at birth, their mouth might be slipping back so that they just have the tip in their mouth. So a lot of times, the first few times a kid nurses, I'm holding its head in place if it keeps losing the teat, because they're not going to get any milk if they keep losing the teat. But the other thing is, if the teat slips to the front of their mouth and they just suck like to try and hold on to it, they're going to hurt their mom, and then she's going to be like, and she's going to walk away. So if you see that your baby goat having trouble keeping the teat in its mouth, if it's a newborn, it just might need a little bit of help for the first hour or so till it gets a little bit stronger and learns how to nurse. You usually don't need to help much more than that.